Hello, my name's Rob Webster. I'm the Chief Executive Lead for the West Yorkshire and Harrogate Health and Care Partnership. I'm going to take a couple of minutes just to explain what we've been doing this year and to reflect on what might happen next year. At this time of the year, it's good to look back and see all the things that have been achieved. And when we look at West Yorkshire and Harrogate, we can point to a partnership that covers 2.6 million people and spends about £5.5 billion together. Over the last year, we've really made some big differences to people right across the region. If we look at, for example, child and adolescent mental health services, this is something that's in the news quite a lot. We found the site for our £13 million new investment in a new unit, which will be centred in Leeds. That will increase the number of beds available and stop people going out of area. Before that's built though, we've been working together to make sure that that is the case more often, that we treat children and support their families in the places that they live. By working together already this year, we've nearly halved the number of bed days for children in child and adolescent mental health units, and we've saved enough money to put £500,000 back into community alternatives. If you take broader mental health services, we've implemented new services for mums who are about to give birth and in the post-birth period, what we call perinatal mental health services, to make sure that people who might have mental health issues or conditions are supported and stay well. That's good for them and good for their families. We've introduced a new model for eating disorders, something which was lacking in West Yorkshire and Harrogate. So there's a specialist service and there's a local service which is connected to it in every one of our places. If you look at some of the other big things that affect us, like strokes, we've had over 2,500 conversations with local people about stroke care this year. We've strengthened the way that hyperacute stroke units work, so that if you have a stroke, you'll be treated in the best place possible to save your life and give you good outcomes. But that alone isn't enough. That's what you've told us. You want us to prevent strokes and you want better stroke aftercare. If you look at the prevention side, we're working with practices now to make sure that your GP can diagnose and spot atrial fibrillation, a heart flutter, more often and give you the right support. Already 450 more people with atrial fibrillation have been diagnosed this year. And we know that that will save strokes, save money and save lives. If we look at big killers like cancer, then we're doing significant work in this area. Right across West Yorkshire and Harrogate, we're focusing on things that are going to make the biggest difference in our communities. That's about early detection. That's about tackling some of the big killers like lung cancer. So we're investing nearly £1 million in how we reduce the incidence of lung cancer and improve the number of people who survive from lung cancer, focusing on work in Wakefield and Bradford. We're also making sure that more people come forward sooner and that we diagnose cancer sooner. So in Leeds and Airedale, we're working on specific schemes to look at vague symptoms. How can you quickly diagnose what's wrong with them, including ruling in or ruling out a cancer diagnosis? These things will save more lives and improve outcomes for people right across West Yorkshire and Harrogate. This year we've been successful in becoming part of a local health and care record exemplar, which means we can share the right amount of data across organisations and the system to make sure that the people looking after you always have the information they need. And as part of this programme, you can have access to your data and your care record to hold yourself. That'll be a significant driver of change in the future. And recently, because of the success of our programme, we've been able to attract £236 million worth of capital expenditure, which will go towards improvements in our hospitals, improvements in mental health services, and improvements in things like pathology, so that we can connect up the way that tests are done, so they're done more efficiently, more effectively, and more cost effectively. These big schemes and big pieces of work would not be possible without the strength of our partnership. Local government, the NHS, charities, communities, all working together. And we set out at the start of this year in our document, Our Next Steps for Health and Care, our plans for the future. And it's great to reflect that many of those plans are really making a difference today. Often though, it's not just the big stuff, is it? It's the little things that really matter. And some of the things I'm most proud of are the little things that we've implemented right across the board. Take the red bag scheme, a simple idea. If you go into hospital as someone who's a resident in a care home, having a bag with your possessions in, your drugs and your information, which travels with you, which won't be lost, which will ensure you get good and effective care, is a simple intervention that will save lives and improve care. These simple things, alongside developments like training 200 optometrists to spot glaucoma when you go for an eye test, and looking at winter warmth with our housing associations and our council partners, will ensure that we do what we've set out to do, which is to improve the outcomes that local people want to see and to improve care by joining it up. This is possible because our partnerships become stronger, and that was officially recognised this year. We stopped being a sustainability and transformation partnership, if you want that jargon, and became an integrated care system. The difference between the two is that we get more autonomy, we get more say, and we get more choice over how we spend our money together on the things that really matter. As part of that, we were given £8.6 million to invest in things that we thought would make a big difference right across West Yorkshire and Harrogate. So we invested that in three things broadly. Firstly, general practice and what happens in community services. Secondly, we put about £4 million into urgent and emergency care, because we know we need to strengthen the response that we give to people when they're sick and in need. And thirdly, we put £1 million into tackling loneliness, which is one of the things that blights modern society, with older people particularly affected. And that was a reflection of all of the work that we do together and the priorities that we wanted to invest in as a partnership, not because government says, but because that's what people tell us. Alongside that, we were able to put some more money into our workforce, and that's incredibly important too. And I'll come back to that in a minute. Our partnership is becoming stronger. We're strengthening the arrangements around democratic accountability. Next year, we will have a full partnership board which meets in public, which will be chaired by Councillor Tim Swift, leader of Calderdale Council, on behalf of all of us. Every chief executive, every chair will be involved. Council leaders and nominated representatives from all our councils will be involved. And that partnership board will oversee our strategy and the work that we need to do to implement the new long-term plan for the NHS. That's expected imminently. It will describe how we get to spend more resources, 3.5% a year more in real terms in our NHS services. And I'm hoping that that's backed by more money for social care and more money for public health. Only by putting those things together can we make the biggest difference possible. Now, all of that can only be delivered if we focus on our people. I've always understood that the health and care system is a people business. What we do is we take somebody who needs help, somebody who can give it to them, and we put them together. And we're focusing significantly on our workforce because they're our biggest asset and the biggest thing that we need to keep hold of and value. That's why we published our workforce strategy this year. That's why we're recruiting 110 GPs from abroad to supplement the staff that we've got here today. That's why we're investing £1 million in workforce and wellbeing programmes which will value and retain the staff that we have, because without them we won't deliver. And the wellbeing of staff, the well-being of our organisations is of critical importance to us. And at this time of the year, during this festive period, where we do spend time thinking about others, where it is the season of goodwill, we should have that at the forefront of our minds. So, I wish you all a Merry Christmas. When I look back across what we've delivered in the last year, It makes me really proud to work in this system. You should be proud too. Enjoy some time with your families, and let's hope that we have a quiet Christmas right across the system.